See, Ayurveda provides a permanent, non-recurrent solution which is non-surgical as well, which is called as Kshara Karma. It completely burns and it falls off on its own. We need not cut it, we need not suture it, we need not use any other surgical techniques to let this pile mass to fall. In case of hemorrhoids, we will see that there is bleeding, but the bleeding will be painless and the type of bleeding will also differ. And along with constipation, I am also sometimes getting bleeding. Right? All these are common complaints that patients tell me. Pressure inside the anal wall is absent since it is towards the gravity. In our previous video, we saw what is anal fissure. In this video, let us see what is hemorrhoids, or as we commonly call piles, and what piles are, why does piles come to us, how to know if you are suffering from piles or hemorrhoids, and what is the unique Ayurvedic non-surgical solution for permanent cure from piles. So in this video, we'll be looking at all of these.
Om Shri Dhanvantre Namaha.
Now let us jump straight to the topic. What are hemorrhoids or piles? Hemorrhoids or piles are nothing but anal cushions or masses which are present either inside or outside the anal canal. And why do these masses occur? These occur because the pressure inside the anal canal increases, which is making the veins, especially in your anal canal, to protrude outside and form small masses. For example, you can see in this particular model that there is a hemorrhoidal mass which is present here. You can see blue dots as well, right? These blue dots are nothing but veins, and it can be either internal, as we see in this case where it is present inside the anal canal, where most patients do not even know that they are suffering from piles. And in this case, we can see that there is an external hemorrhoid where the patient comes to us saying that there is a mass which is present outside the anal canal. So it can be either internal or external. In some cases, it can be internal or external as well. Now, why does this occur? Why does a mass occur in your anal canal, and why is it mainly seen in veins? Now see, in my hand, you can see that there are certain veins, right? I hope it is visible. And these veins are engorged right now. Now, when I do this, do you see the same veins that you have seen a while ago? No, right? Why is that? It is because the pressure inside the anal wall is absent since it is towards the gravity. Now it is against the gravity, so the blood inside is pooling up, and the pressure inside the anal, the pressure inside the vein has also increased, because of which you can see that there is engorgement. Similarly, when the pressure inside the anal canal increases, the veins which are present, especially at three locations, what are they? Imagine that this is the anal canal. Imagine the opening of the anal canal to be like a clock, which is like a circle, right? Now the clock has multiple hands, 1 o'clock, 2 o'clock, 3 o'clock, multiple, right? Imagine that there are 3 points, 3 o'clock, 7 o'clock and 11 o'clock. I'll put an image here. In these three areas, there are lots of venous plexus which are present, and these venous plexus can form hemorrhoids when there is lot of pressure to these areas, and that is how hemorrhoids generally occur. And these hemorrhoids which form at 3 o'clock, 7 o'clock and 11 o'clock are called as primary hemorrhoids, which is most commonly seen in our day-to-day practices. Now, why does this occur? As I told you, the pressure inside increases. Why does the pressure increase? One of the most common causes is because of constipation. You have some food outside. Most commonly what patients tell me is, doctor, I had chicken outside, doctor, I had lots of eggs, or doctor, I had very less fiber in my diet, and now I have constipation, and along with constipation I am also sometimes getting bleeding, right? All these are common complaints that patients tell me. So constipation is one of the most common causes for hemorrhoids to form. Other uncommon causes could be chronic cough, chronic COPD, or even in cases where there is liver failure because of multiple secondary conditions. Even in such cases, hemorrhoids can form. Now, what are the symptoms of piles or hemorrhoids? That is, if you ask me, doctor, how do I know if I have hemorrhoids, or if somebody that I know has hemorrhoids or piles, apart from the mass that I see? Because sometimes the hemorrhoids can be internal and you might not see any mass which is present outside, right? How do you know? So one of the most common signs that a person might be suffering from hemorrhoids is bleeding. But in the previous video, we saw that in case of fissure, the bleeding is along with pain. But in case of hemorrhoids, we will see that there is bleeding, but the bleeding will be painless, and the type of bleeding will also differ. That is, in case of fissure, we will see that there are streaks of blood. Why? Because we can see here there is a strip which is present here. When the stools are coming, there is a cut which is formed and there is streaks which are seen. But in case of hemorrhoids, it is drops or what we call as splash on pan kind of bleeding. That is, if the bowl is there, that is the toilet bowl, in that there are drops which form, which fall and which causes a splash in that pan. So the bleeding will be painless. It will be like drops kind of bleeding, and usually the color will be a bit darker because it will be from the vein. So these are the most common signs that the bleeding is because of hemorrhoids, and as I told you, it will be painless in most cases, unless in rare cases it can be thrombosed. That is, because of excessive constipation, you create lot of pressure in your vein and a small vein bursts open and a clot forms there, and this clot can be painful. So in such cases, rarely you might have pain in hemorrhoids, but in 99% of cases it will be painless and the bleeding will be dropwise. So these are the signs that a person might be suffering from hemorrhoids. Coming to the final question of the day, what solution does Ayurveda provide for this condition called as hemorrhoids? Now see, this condition is a condition which is generally not spoken much about to the people which are present around us, right? So most of us try to somehow cure this condition with home remedies. We try to get some ointments, we apply that, we take some oral medications seen online. These are the general lines of treatment that we try to do in this condition. But what we see is that there is no permanent solution in this condition. You apply an ointment, you take home remedies, you do a certain diet, it is good for a certain point of time. Again, there is recurrence when you have chicken outside, when you have lots of non-veg, or when you have a very bad diet, or when your sleep is bad. All these can again cause bleeding or symptoms. Now, what is a permanent solution for this then? See, Ayurveda provides a permanent, non-recurrent solution which is non-surgical as well, which is called as Kshara Karma, wherein we apply a certain medicine to your pile mass, and because of this medicine, this pile mass completely burns and it falls off on its own. We need not cut it, we need not suture it, we need not use any other surgical techniques to let this pile mass to fall. So how does this work? See, in this image, I show you a case which I have performed where a person had a huge hemorrhoidal mass. And I'll tell this to you, the person did not know that they had hemorrhoids until we found it out through the proctoscopic examination. Anyway, so these huge hemorrhoids were present at 3 o'clock. And when we applied the Kshara, it becomes like this. It becomes white because the Kshara is white in color. And after removing the Kshara in a period of 60 seconds, we see that it turns into blackish blue in color. This is because liquefaction necrosis has occurred in this particular area. That is, in simple terms, there's death of the tissue, and in a period of around 7 to 14 days, the whole of the mass falls on its own, and there is a scar which forms in this region, and this scar is generally very tough. And because of the toughness of the scar, there are very less chances that hemorrhoids can again occur in the area where Kshara Karma has already been done. So this is how Ayurveda can give a permanent, non-surgical, non-recurrent solution for this condition called as hemorrhoids or piles.